Hi, my name is Max Madden, and I will be doing the narration for Group Three's presentation in early childhood development. And so our presentation is on cerebral palsy. So cerebral palsy is sort of an umbrella term that refers to a few different disorders that affect a person's ability to move. It is due to damage in the developing brain during pregnancy or shortly after birth. So it affects everybody in different ways. It could be reflex in your posture, balance, muscle coordination, muscle tone, body movement. There's a lot of different ways that it can affect you, and it is a lifelong condition. So there are a few different types of cerebral palsy, as I mentioned before. There's spastic cerebral palsy, which is the most common type. It causes excessive and jerky movements of the body, and at the same time, it can also cause sort of stiffness in the body. There's ataxic cerebral palsy. It affects a small population, but it affects one's ability to speak, move, your depth perception, and shakiness. It's also likely that you may have weaker muscle tones. Then there's atheroid cerebral palsy. Like I said before, it's actually kind of like a ataxic cerebral palsy. It takes up a smaller population of children, but it causes involuntary movements to the face, limbs, and torso, along with poor body posture, feeding problems, or, as with other types, floppy or stiff bodies. And then there's mixed cerebral palsy, which is when the brain is damaged in more than one location, which causes various forms of cerebral palsy and different symptoms. This is the least common form. So there are a ton of causes that cerebral palsy can come out of. It's likely the combination of events either before, during, or after birth that can lead to an injury in the baby's developing brain. It leads to maybe a premature birth, a low birth weight, blood clotting problems, bacterial infections, prolonged loss of oxygen, and an inability of the placenta to provide oxygen and nutrients. There are a wide variety of things that can cause cerebral palsy. Now, there are different treatments. It is really important to know that early treatment has the best chance of improving cerebral palsy. And those treatments can include medication, medical procedures, and therapists. So medication, oftentimes you're looking at muscle relaxants or Botox injections. Medical procedures, dorsal rhizotomy, and orthopedic surgery. And then for therapies, there's recreational therapy, speech and language therapy, occupational therapy, and physical therapy. So, kind of the therapies that you'd expect given the symptoms of cerebral palsy. Now, the prognosis is unique to each individual case and not predetermined or permanent. So in terms of the life expectancy, of course, it varies based upon the severity of the condition. You also are wanting to do, extensive evaluation by a physician because each case is so different. You need to detect and manage symptoms, disabilities, and potential complications, and propose a possible treatment plan based on, your given situation. And statistics from over 1,300 studies help provide some insight on potential complications associated with cerebral palsy. Early intervention and treatment is very crucial. It is not a progressive disability, so early intervention will help with improved quality of life. And studies show that prognosis for ability to walk improves if a child learns to stand and sit without assistance at an early age. So how do we sort of put this in the context of this class and education? So how can teachers and parents help children with cerebral palsy? So with parents, it's really important to encourage a positive attitude, outlook, social behavior, and inclusion, to modify the home in a way that is safer and easier to access and utilized by children with cerebral palsy. Like I mentioned before, that sort of ties into assistive devices and technology, and then, find ways for the children to adequately, get their nutrients. So, finding ways to feed them. Teachers always It's really important for teachers who have students with cerebral palsy to create an inclusive classroom and playground environment, and make sure that the classroom is really physically accessible. Of course, limiting bullying, which can be difficult with the stigma of such a disease as cerebral palsy, and communication with parents and teachers of course is crucial. And some really important support groups that can help for families and children dealing with cerebral palsy is the United Cerebral Palsy organization, CPFN, which is the Cerebral Palsy Family Network, which is a YouTube channel with lots of really helpful information on cerebral palsy, and then the Cerebral Palsy Support Network. Additionally, the Daily Strength website, which is an example of an online support group, as well as parent movements and fundraisers. So that is our presentation, and thank you for listening.